The definition of multi-drug-resistant TB is the TB which is resistant to two most commonly popularly used drugs, that is rifampicin and INH. So without these drugs, you cannot cure TB. So that is the condition. So when these two drugs, they become resistant, then it is called as multi-drug resistant TB. Though we have 4 drugs, these 2 drugs are very, very important. That is your MDR, multi-drug resistant TB. What is XDR? So TB caused by a mycobacterium, which is already resistant to INH and rifampicin. That means the MDR bacilli, when they become resistant to fluoroquinolones, levofloxacin or moxifloxacin, and along with it, if they become resistant to the newer drugs like bedaquiline or linezolid, these are the 2 newer drugs, very important drugs. Either of them or both of them, if they become resistant, then we call it as XDR. So it will be difficult uh, for the treating physician to cure these patients, because the bedaquiline is a new drug, a very good drug, so which has given hope for those patients who are suffering from XDR. So if that is gone, then it will be very difficult. So of course, the research is going on. The other regimens are also coming. So uh, the message is very, very clear. The practitioners who are practicing TB, sometimes there are practitioners who are practicing MDR-TB also. So they should be very careful. Never misuse the drugs which are new drugs. See, we have faced multi-drug resistant TB and we have killed many patients because we have misused rifampicin. The message is very clear. We should never misuse the drugs. The patient should get the proper dosage, proper regimen, and patients also should take all the drugs responsibly. If this program gives a very clear message for those who are suffering from TB, if the doctor says 6 months of treatment has to be taken, the patient has to take it, whatever uh, the patient is. So they have to complete the treatment. That is very, very
Yes, doctor.
important.